It can be a lot caring for a loved one diagnosed with dementia. The physical and emotional toll can be especially overwhelming for those who
Dementia.
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 Have you ever walked into a room and forgotten why you went there? Or paused in the middle of a sentence, trying to find the right word? It happens to all of us. Most of the time, it's nothing to worry about. But sometimes, these little things are signs of something more, something that can quietly change how we think, feel, and live without us even noticing. Dementia isn't a specific disease. It's a word we use when someone's memory, thinking, or decision-making starts to get worse over time. It's not just about forgetting names or where you left your keys. It's when those changes begin to affect daily life. Things like following a recipe, paying bills, or simply holding a conversation. But here's what most people don't know. Dementia doesn't always start with memory loss. Sometimes, the early signs are much harder to spot. Right now, over 55 million people around the world are living with dementia, but many of them don't even know it yet, because the symptoms can sneak up slowly over months or even years. Stick with me, because by the end of this video, you'll know how to spot the signs that often get overlooked and what you can do if you notice them. Let's get into it. So, what is dementia exactly? The word dementia covers a group of conditions that affect the brain, especially memory, thinking, and problem solving. Alzheimer's disease, for example, is the most common type of dementia. But it's just one kind. Let's quickly go over the main types so you know the difference. Alzheimer's is the most common form of dementia, accounting for 60 to 80% of cases. It happens when abnormal proteins, called amyloid plaques and tau tangles, build up in the brain. These proteins block communication between brain cells, and over time, those cells die. It often starts with short-term memory loss. Someone might forget recent conversations or repeat questions. As it progresses, Alzheimer's affects thinking, behavior, and even personality. Vascular dementia is caused by reduced blood flow to parts of the brain. This can happen after a stroke or from damage to small blood vessels over time. In the early stages, it often affects thinking and decision-making more than memory. People may seem slower, more easily confused, or disorganized. Planning tasks, staying focused, and following steps can become harder. Lewy body dementia is caused by tiny abnormal protein deposits in the brain, called Lewy bodies. One of the early signs is vivid visual hallucinations. Seeing things that aren't there. People may also have trouble sleeping, sudden changes in attention, or movement problems that look similar to Parkinson's disease. Their alertness might shift quickly. Clear one moment, confused the next. Frontotemporal dementia, FTD, often affects younger adults, typically between 40 and 65. It starts in the front part of the brain, which controls behavior, judgment, and language. Early signs might include impulsive or inappropriate actions, losing interest in hobbies, or struggling with words. Memory issues usually come later. Sometimes, people have mixed dementia, where more than one type, like Alzheimer's and vascular dementia, happens at once, making symptoms more complex. Each type of dementia affects the brain in its own way, but they all share one thing in common. Over time, they interfere with how a person thinks, remembers, and lives their daily life. And that's why knowing the early signs, no matter the type, is so important. For more details, the elite biohacking community for vibrant living has more tips to optimize your wellness. Check the link in the description below. Dementia can sneak up slowly, so recognizing its early signs is crucial for getting help sooner. Let's explore the key warning signs to watch for, so you can spot when something might be more serious. Symptom 1. Memory issues. Forgetting a name or missing an appointment now and then is part of being human. With early dementia, though, memory problems are more persistent and disruptive. Someone might ask the same question over and over, even minutes after hearing the answer, or forget entire conversations they just had. According to the Alzheimer's Association, this kind of memory loss, especially with short-term memories, affects up to 80% of people with Alzheimer's. Symptom 2. Trouble with familiar tasks. Struggling to learn a new gadget is one thing, but when someone can't manage tasks they've done effortlessly for years, it's cause for concern. Picture someone who's always brewed their morning coffee, now puzzled by the coffee maker's buttons. Research shows this difficulty often arises from changes in the brain's ability to plan and sequence steps, a hallmark of Alzheimer's or vascular dementia, and it can appear years before a diagnosis. Symptom 3, language problems. We all stumble over a word occasionally, especially when tired or stressed. In early dementia, however, language issues become more frequent and noticeable. Someone might stop mid-sentence, unable to find the right word, or describe a spoon as that thing. Because the name escapes them, conversations may become frustrating for everyone involved as they struggle to keep up. Studies suggest that language difficulties, especially in frontotemporal dementia, affect about 20% of people in dementia's early stages, often making communication a daily hurdle. Symptom 4, disorientation with time or place. Mixing up whether it's Tuesday or Wednesday happens to everyone now and then, but dementia can cause deeper confusion, like forgetting what year it is or losing track of the season. Someone might walk around their familiar neighborhood and suddenly not know how to get home, even after living there for years. This disorientation often stems from damage to the hippocampus, a brain region vital for memory and navigation, and affects about 1 in 6 people with early dementia. Symptom 5, poor judgment. Dementia can weaken the brain's knack for reasoning, leading to choices that seem out of character. Someone might hand over thousands of dollars to a telemarketer or wear a heavy coat on a scorching summer day. These aren't just quirks. They signal changes in how the brain processes logic. The National Institute on Aging notes that financial mismanagement is a red flag, with up to 30% of people with early dementia falling for scams or making risky money moves. Symptom 6, mood or personality changes. Everyone has moody days, but dementia can bring lasting shifts in personality. A person who's always been kind and patient might become irritable, suspicious, or anxious. Others may pull back, losing interest in hobbies like gardening or family gatherings that once lit them up. These changes, often seen in Lewy body or frontotemporal dementia, affect about 40% of people in early dementia, sometimes even before memory issues stand out, according to research. Symptom 7, losing items and getting confused about where they go. Misplacing your phone or glasses is normal, but with dementia, someone might tuck their keys in the freezer or their wallet in a bathroom cabinet and have no memory of doing it. Worse, they might accuse others of stealing because they truly can't recall moving the item. The Mayo Clinic reports that this repetitive misplacement, often paired with paranoia, occurs in up to 25% of early dementia cases, creating tension for families. For more insights and practical health tips, the elite biohacking community for vibrant living has more. Check the link in the description below. So what's actually causing these changes in the brain leading to dementia? It depends on the type of dementia, but in all cases, something is damaging brain cells. In Alzheimer's, it's abnormal protein buildups, called plaques and tangles, that block communication between brain cells. In vascular dementia, it's poor blood flow, often from strokes or damaged vessels, that starves brain cells of oxygen. In Lewy body dementia, there are protein deposits that disrupt how the brain works, especially with movement and attention. And in frontotemporal dementia, there's damage to the parts of the brain that control behavior and language. The cause may differ, but the result is the same. Brain cells stop working, and over time, they die. That's what leads to the changes in memory, thinking, mood, and daily life. Right now, more than 55 million people around the world are living with dementia, and sadly, most aren't diagnosed until it's already advanced, when options are fewer and daily life is much harder. But it doesn't have to be that way. Catching dementia early can make a big difference. That's because lifestyle changes and medications work best in the early stages, helping people stay independent longer, enjoy better quality of life, and plan ahead. If you notice signs in yourself or someone else, start by writing them down. Track patterns over time. For more details, the elite biohacking community for vibrant living has more tips to optimize your wellness. Check the link in the description below, and if needed, ask a doctor for a simple memory check, like the mini mental state exam. A few small steps now can lead to better support later. Share your experience in the comments. You never know who it might help. Make sure to give this video a like, hit subscribe, and check the description for free resources.